World Advanced Therapies and Regenerative Medicine Congress interview zone. My name is Freya Leaf, I'm the editor of RegMedNet, and I'm your host for today. And I'm very pleased to be joined by Amy Hines from Be The Match Biotherapies. So Amy, thanks so much for joining me today.
Thank you for the opportunity.
So for people who may not know Be The Match Biotherapies, can you tell us a little bit about the company and how you came to work there?
Absolutely. So Be The Match Biotherapies is a nonprofit subsidiary of Be The Match. You might know Be The Match as the National Marrow Donor Program.
Okay.
And for the past 30 years, we've been facilitating unrelated allogeneic stem cell transplants globally for patients in need. So a little over 3 years ago, realizing the direction of new advanced cellular therapies, Be The Match Biotherapies came to be to leverage those skills and knowledge that we've gained over the past 30 years of unrelated bone marrow transplants.
Fantastic. So obviously regenerative medicine and advanced therapies production has expanded massively over the last few years. What is integration and data continuity in this sort of context?
Yeah, absolutely. So, it's been really interesting in that it has rapidly expanded so quickly. And because of that, everyone's kind of doing things their own way. So companies are working individually with clinical sites in their own way, collecting all kinds of wonderful data, using great processes and procedures, but they're all slightly a little bit different. But now that we're kind of seeing this field kind of en masse, roll out to globally, there becomes really a need to start to integrate processes and procedures to kind of limit the variability in these processes and procedures that are out there. Things that are not proprietary to a particular drug or therapy. Really, we're looking to standardize those things. And in terms of data, again, there's so much data out there. Everyone's kind of collecting things a little bit differently. But one thing that we learned from Be The Match is that there is value in really evaluating and using pooled data to identify best practices to really improve outcomes. And so Be The Match and the National Marrow Donor Program have partnered for years, for over 40 years, with the Medical College of Wisconsin and formed the CIBMTR, or Center for International Bone Marrow Transplant Research. And through that organization, outcomes have been collected on unrelated stem cell transplants forever. And because of the research that's done on that data, transplant outcomes have improved dramatically over the course of the years that data has been collected and analyzed. And it's really learning from that experience that really shows us that in this field of regenerative medicine, as it's starting to grow and expand, that there is so much value in learning from each other and really improving processes to improve patient outcomes.
I mean, that must be quite a challenge with a lot of advanced therapies, because the patient population is so small, so few people have actually received the therapies to get that outcomes data. How does that sort of compare with, obviously, Be The Match, which has thousands of patients that you've been able to follow with many years?
Yeah, well, I think that almost, if anything, really proves that we're at a point now where we do need to start pooling that data, because each individual indication may be small, but together there's value in those larger numbers. So pooling that data together can really help to improve some of these processes that are out there.
Okay. So what are the obstacles? Why haven't we done this before?
Yeah, I think everyone's just been too busy. In all honesty, I feel like, these therapies are amazing. And, everyone really wants to be able to get these therapies to patients in need more quickly and more efficiently. And the things that, like data and like standardization of practices, really is really becoming obvious now that we need to be doing this as this therapy world has grown.
Mm-hmm. Yeah. And how is Be The Match Biotherapies aiming to address these challenges?
Yeah, so in several ways, again, because of our experience in having facilitated these unrelated transplants for so long, we're really able to identify areas of standardization. So our organization is working actively with a standards coordinating body and other international partners to identify areas in which we can standardize processes. So if it's the cell collection, if it's cryopreservation, if it's labeling, all of these different aspects of the of the process that have an opportunity to be standardized, perhaps we can do that. Secondly, we also have realized by working with our network of over 85 apheresis centers around the country that there's a lot of stress around the auditing process. Each individual company that goes into a facility has to audit the center and qualify them to be able to collect product and infuse product at that site. And what we're hearing from our partners, our network partners, is that it's incredibly resource draining and time consuming for them to host multiple audits that are relatively similar. So about a year ago, we launched a program called the Quality System Audit Program, which really allows Be the Match Biotherapies qualified auditors to go in, audit the apheresis and cell therapy lab to applicable GTP GMP requirements, and then provide that audit to companies that are looking to go into that facility, and hopefully save that facility some audit time. And then finally, as I mentioned before, the CIBMTR continues to participate in the gathering of data. Most recently, they have begun collecting long-term outcomes data for 2 commercial CAR-T products, Kymriah and Yescarta. So we're actively involved in taking cellular therapy down that new path.
Oh, fantastic. So what can we look forward to from Be the Match Biotherapies in the next few years?
Yeah, well, it's a very exciting time for us, as well as I'm sure for everyone else in this field. I think in the next few years you can expect to see Be the Match Biotherapies continue to be a thought leader in this space, to continue to participate actively in the development of standards, to really do what we can to improve the patient experience, the apheresis center experience, and the cell therapy lab experience, and being able to bring these therapies to their patients. And finally, to be actively involved in developing processes to collect and process data and really identify the best practices that are out there.
Fantastic. Well, the future definitely sounds exciting.
Yes.
Amy, thank you very much for talking to me today. Thank you all for watching, and I'll be back with another interview from the world of advanced therapies very soon.